So I'm here today with one of the reggers that were present at Suturing Night. Can you just introduce yourself and what you do?
I'm Dulani. I'm a general surgery Set 4 trainee, so I'm in my second last year of training and I'm working at Blacktown at the moment. I'm doing general surgery.
Nice to meet you, Dulani. So why did you choose general surgery over other surgeries?
I really like the acuity of general surgery. I like emergency surgery, so that's what drew me to it. And I like the breadth of it. There's a lot of subspecialties within general surgery, so you get exposure to heaps of different surgical specialties. And that's sort of what drew me to it.
If you had to choose one other surgery specialty to do, or even any other specialty, what would it be?
I'm interested in head and neck surgery, so I'd probably do ENT. But I sort of liked a lot of general surgery and I didn't like some parts of ENT, which is why I picked general surgery in the end. But that's probably what I would do if I didn't do general surgery.
Yeah, I remember being in the presentation room with all the others presenting on parathyroid, and that was really interesting.
Yeah.
So what's something other than medicine or just outside of the medical life that you did that helped you along your journey to become a surgeon?
I think you just need to find something that keeps you sane and you've got something to do. I played a lot of sport throughout, even in uni. I played heaps of sport. I played guitar, pretty good for hand-eye coordination maybe. But I think it's important to have focuses outside of surgery. So I think finding something that you enjoy is important.
And if you were to share a patient story that really stuck with you along all these years, and maybe you even learned like a moral or any kind of lesson out of, would you care to share that very briefly?
It's a tough one on the spot. It's hard to think of a specific thing. I think it's a general thing. I think particularly in surgery and in general surgery and in acute settings, you'll be dealing with really vulnerable patients and they're often really sick and they don't know much about what's making them sick. And I think you can provide, a lot of help and you can really sort of guide them through their treatment and their progress. And I think if you're just open and you explain things well to patients, I think they thank you for that. And I think that's actually a really rewarding part of my job, getting to work with patients, getting them to trust you. And it's really rewarding, someone's sick, you do an operation, they get better. I think that's a really nice part of the job. So yeah.
I think one thing that attracts a lot of surgeons to surgery is how tangible and how immediate some of the results are. It's very straightforward and very logical. And you're fixing a problem rather than hoping that a problem will be fixed most of the time.
Yeah, I realised I wanted to do surgery when I was probably your level, the last 2 years of medical school. And I really liked the immediacy of surgery. I really liked that I could see a problem. You have someone with appendicitis, you take out their appendix, the next day they feel better. And that's a really rewarding thing. Obviously, it doesn't always go like that. But one of the reasons I liked surgery and what drew me to surgery early. And I think that's a great part of it.
And lastly, if you had to give one piece of advice to any medical student wanting to get into general surgery or even head and neck surgery, what's like the most important piece of advice you would give them?
I think you need to plan. Okay. I think there's a lot of steps now to get onto training programs. And I think if you plan ahead and, have a goal early, that's really helpful. And just do those little steps, doing your research, doing your teaching. I think that's really important. So I think doing that from an early stage is probably the best way to set yourself up to getting onto a training program.
Perfect. Thank you so much, Dulani, and wish you all the best.
Thank you.
Cheers.